Yeah, so as Josephine is preparing, just in case somebody is missing out, please send a link to them to join so that we learn together as always.
Okay.
Sana, Josephine. Thank you.
Okay. All right. Good morning forever. Good evening, those who are new on the platform. Welcome to you all. As already mentioned, my name is Josephine Mwedekeli. I'm a very excited member of Forever Living Products. It's been an interesting journey for the past 28 years. Every time I wake up, I feel blessed to be a member of this amazing company, Forever Living Products. But today, as you can see from the poster, we're going to be focusing on women's health. And part one of the women's health is a specific topic. This topic is dedicated to an amazing lady, which really touches my heart. Amazing lady called Jambi Korkai, who passed away, unfortunately, at a very young age, passed away last week. So I know some of you or many of you would have heard about this amazing lady. She was very energetic. I really praise her and admire her energy. And she's been popular in the music world and very hardworking, very dedicated, and loves the community where she grew up. And she really tried her best. Part of what she was planning to, I would say, her aim was to become an MP for that area in Nairobi. It's an area that I've just escaped my mind now. That's near Junction. I can know it's just near Junction. That's the area where she was born near there. And the southern part of that's where she was contesting to become a member of parliament. And understanding what she went through over the years, and she had to have that energy to want to become an MP because of her mission and her vision is to help the youngsters to in terms of employment and so many things she wanted to do. But unfortunately, she did not live to achieve the dreams. And I just feel I should share because of what she had, what she went through. And that's what has prompted me to want to talk about this topic, to enlighten many, especially we're talking about women's health, to enlighten as many women as possible about this situation so they can help us to prevent, or if they've had anybody who's actually going through it, to help with the knowledge to now share with them how they can manage that condition without being exposed to those, I would say, conventional medicine which are known to have a catalog of side effects. So let me move on with the presentation today. And let me move on. Okay. The topic, as you can see, is as part of women's health, is understanding endometriosis and its complications. And because I have a lot of information to share with you, so I don't want you to be bored with me because I know within the next 1 hour, all of you will be closing down on me. So I have decided to divide into 2 parts. So the part 1 will be today, part 2 will be next week. That will be a nutritional approach with using the products from Forever Living Products. That's I know some of you want a quick, maybe some of you will be disappointed today because you want a quick solution. But I have to keep in suspension. Today is about educating you about the condition known as endometriosis. With you having that good understanding, then you'll be able now to pass that information to your customers and know what to recommend, or be able to have good understanding as to why we are going to be recommending our products next week. So I'm showing a video here. I hope you're all here and welcome back again. So that was Njambe Korkai. Actually, well, I remember now vividly about political ambition because she was contesting to become an MP for Dagoretti South. As many of you in Kenya or in Nairobi, you understand that what I mean, that area. So let us now start with the topic of today, which has actually taken a life at a very young age. And mind, before I start, with her, she had 18 operations. Initially, she was misdiagnosed. This is the issue with endometriosis. Many women who have suffering from endometriosis, they are often misdiagnosed, which is very, very sad. And because of misdiagnosis, she went through so many different operations, 18 operations in Kenya. Just imagine, 18. So she was finally diagnosed at Aga Khan Hospital. From there, she was lucky to be transferred to US, where she was told that's the only place, because they tried India. India said they could not handle a situation because it was too severe. So she was then linked to an organization or establishment in US. That was where she had another set of 3 operations. Can you imagine that? She went through all that. It's not, I mean, it's a lot. As a woman, I feel really for her. And this is why I'm so passionate to want to educate as many women as possible about this condition. I know many of you have sisters, you have mothers, you have so many women in your life. So this is a very, very important topic to go through quickly. Now, as you can see on the slide, what do you mean by the condition which took her life, called endometriosis? So according to, in the medical world, it is known, it can be classified idiopathic condition, which means that doctors don't know much about it, okay? So which affects some women with women with uterus. Obviously, now it also affects anybody with uterus, especially women with uterus. So in simple terms, you can see it because when a tissue similar to the, inside the womb, you have the inner lining, for endometrium, okay? The lining contains endometrial cells. So this is that inner lining of the womb, okay, or the uterus. So which is called endometrium. So with endometriosis, that's the original place where those cells are lined. But when we're talking about endometriosis, it grows outside the womb. So it's no longer in that original place where it belongs. It grows outside the womb, attaching itself to pelvic or abdominal organs. I have better understanding about this condition because working in pathology for over 25 years in UK, that gave me a better insight when we are talking about endometriosis. And I could remember vividly, a lady, was a Chinese lady, who actually I came across for the first time in my life when we talk about endometriosis. This Chinese lady was diagnosed with endometriosis. And unfortunately for her, because the inner lining of the womb traveled to the lungs, which is what actually happened to Jambi. Okay, traveled to the lungs and embedded itself. Those said they embedded themselves inside the lungs. So what happens due to influence of hormones or hormonal influence, every time that Chinese lady used to menstruate, she used to bleed in the lungs. Can you imagine? Women on the platform, you can understand what I mean, how severe, how serious. So every time the woman menstruates, she also, that area where the cells have traveled to the lungs, she used to vomit blood. It was a serious condition, which is similar to what took the life of Jambi. So they can embed itself to anywhere, as you see, as the pelvic or abdominal organs. Sometimes within the abdominal cavity, I'm now looking at the picture because it's what I used to see in pathology. You get where they are deposited, you can get the intestine sticking together. And whenever the woman menstruates, that area starts to bleed. And naturally, by nature wants to now interfere by trying to heal that area. So in the process trying to heal that area, you get scar formation called adhesion. That's what happens. And that's very, very painful. So that's the situation we're talking about, endometriosis. It's most common psychological challenges in women of reproductive age group. And it's this after fibroid is the second most popular medical challenges. And it is an estrogen-dependent disease. In women, we have two main hormones. We have progesterone, we have estrogen. But this is all driven by estrogen. And now it's on the increase because of the food, as I will be telling you later, the food we are consuming nowadays. We call this condition called estrogen dominance. Every estrogen. So this is too much estrogen in the system actually makes the situation worse because it's estrogen dominance, estrogen driven when we're talking about this condition called endometriosis. So look at the picture. This is a picture of a normal anatomical picture of a woman's reproductive system. Here you have the vagina, you have the cervix, you have the neck of the womb there, you have the ovaries, you have the two ovaries, then you have the uterus here, then you have the fallopian tube, also now with the ovary there. So just taking you back to your basic biology here. So this is that's a normal situation, anatomical arrangement. Now, when we are talking about endometriosis, you find that the inner lining, this is the uterus again, or the womb. That's the womb there. So these cells we are called endometrial cells. This is the normal abode where they should be. But in the case of endometriosis, you find these cells which should be here, they're no longer here. You can find them in the ovaries, okay? They cannot travel to the fallopian tubes, okay? So now they can extend it to other parts of the system. So you can now understand how serious this situation we're talking about. Let me move on. I have a lot of information. So this is another anatomical area of women reproductive system. So that's just to give you more idea of what we're talking about. So as you can see, this one poster concludes everything. But I'll be going more and more better explanation as we move on. So as you can see, experts believe that the number one is they believe that the number one is significantly higher due to underreporting. As I said, underreporting and misdiagnosis, especially in this country, and lack of non-surgical and non-invasive diagnostic method, which is what Jambi went through a lot. So worldwide, it affects over 176 million women. So it's quite a serious condition we're talking about here. And you can see there, this all says it all, but I'm going to expand more as we move forward. So there are different stages. You have a stage 1, which is minimal, stage 2, mild, stage 3, moderate, and severe. Severe, which is what Jambi sort of went through, which led to just having 1.5 lungs left. I'll be talking more about treatment later. So now, when we talk about symptoms, you find that women they experience the stinging or burning sensation, and you can experience sharp or throbbing pain. And the pain travels to other parts of the body, such as the stomach, the back. They tend to have a lot of issue with the back pain, the legs, and during after sexual intercourse, they experience a lot of pain. So you can see this, when we talk about pain, we're talking about severe pain. And this type of pain affects up to 50% of all women. It's very serious. They also, in terms of symptoms, they also develop pain. When they're going to the toilet, they go through a lot of pain. Even during, when they're passing urine, a lot of pain. So, as you can see there with Njambi, it also started with she started having a period at a very young age, and you can see that also, as I said, behind this is when you're talking about a lot of estrogen in the system. So with her condition, endometriosis can start at a person's first menstrual period, which is what happened to her. But at the time, many people did not recognize it as endometriosis. So, and this situation can last until menopause. Why do I say until menopause? Because, as I said, it's influenced by estrogen. So when a woman is going through menopause, you find the estrogen is reduced. So this is why the pain lasts until when the estrogen levels is down or is very low. So it's known to have higher rates of known to have higher rates of depression and anxiety. What do you expect? When women are going through all this, they go into depression and a lot of mental issues. And it causes a lot of chronic inflammatory reaction, which may result in the formation of scars. I mentioned before, you get what you call adhesion inside the internal organs. And also, obviously, during the process of healing of this adhesion, you get fibrosis. So everything's sticking together. So within the pelvis and other parts of the body, which is very, very sad. Let's move on. So there are different types of endometriosis, and you can see they can manifest in different forms, and the severity can vary depending on the type. So the main types of endometriosis that you can see there, there's one we call a superficial peritoneal endometriosis, which is the most common type. This is where the endometrial tissue grows on the lining of the pelvic area, such as the ovaries, and this is the reproductive system area, fallopian tubes, and also the lining around the stomach. And the second one is known as ovarian endometrioma. Okay, or you can call it endometriotic cyst. So when we're talking about the ovarian, which also I'm just looking at the picture now because those are the things I used to diagnose before. Now, you find that sometimes with ovarian endometrioma, it form a cyst and you get accumulation of old blood. We call it chocolate cyst. Can you imagine dark blood? And this is a lot of pain. So this type, as I said, is referred to that's where they refer to it as chocolate cyst. As I said, due to appearance of old blood. That's the ovarian type. Then you have another one called the deep infiltrating endometriosis. This is more severe than because you can see this is where the endometrial tissue, the tissue lining the womb, goes deeper, invades into other surrounding organs, just at the bladder. This is why they experience pain when they're urinating. And this is also the reason why when they are passing number 2, they also experience pain in the bowel and also in the rectum. It's very, very severe pain, very intense. It's just indescribable. From those people I've heard in the previously, the way they used to talk about the pain. So there's another one which also she was diagnosed with, they call it adenomyosis. Maybe it's adeno, okay, meiosis, this is now involving the muscle. Meiosis is to do with the muscle. So this condition, you find this inner lining cell called endometrial tissue, it grows into the muscular wall of the uterus. Okay, it goes outside, so it's no longer within the uterus, it goes now into the muscular wall of the uterus and causing to become enlarged and also a lot of pain. So that's another classification which the lady who passed away was also diagnosed with. So another one there is called rectovaginal endometriosis. In this case, you find this inner lining of that womb now can infiltrate into the rectum, okay, and also the vagina. And the pain is very, very uncomfortable, especially during bowel movement. So with Njambe, she was finally diagnosed, apart from being diagnosed with adenomyosis, she was also, that condition was so bad, which now led to her having where the endometrial cells that I mentioned, which is similar to that Chinese patient I mentioned earlier on. So she was also, because it was not diagnosed on time. So what happened here is that you start having, every time she used to menstruate, she used to bleed in the lungs and also bleeding coming through the mouth. We call it thoracic endometriosis because it's involving the thorax, the lungs. So it's a very rare condition. And when these endometrial patches, when they grow around the lungs, it can cause shortness of breath, which is what she experienced. She used to have issues even before she died. When she used to perform, she used to have issues with breathing because of this, because of the presence of endometrial cells inside the lungs. And she used to stop breathing for some time. And she used to experience a lot of pain in the chest, coughing sometimes, when short cough. I saw one of the going back to one of the video I watched of her when she was performing, and in some cases I know that she also experienced her lungs collapsing, very seriously. Yeah. The treatment options are in which I'll be talking to you about on the few slides coming up. The treatment options, they are usually medication to suppress these female reproductive hormones or surgery. Okay, so that's what they tend to do. If other things fails, like those medication to relieve pain, then that's when now the condition is properly diagnosed. They give them initially they give them aspirin or any of those pain relieving medication. And no, you can't keep on there for too long because many of them, they know to have a lot of side effects. But she had to do all that before she proceeded to have surgery. That's where she went through 80 surgeries in Kenya. So other common sites of, you can see here, other uncommon, unusual, okay, atypical site for endometriosis, it can happen in the heart. Imagine bleeding in the heart whenever the monthly period. Even in the eye, I could not just imagine that. In the armpits, those are usual sites for endometriosis. Now, what are the causes? What are the known causes of endometriosis? So this is where they were now coming about retrograde menstruation. This is when the blood contained the cells are lining the womb. Then they flow back through. They get backflow to the fallopian tubes. So not the usual downward flow through the vagina. Now you get a backflow now onto the fallopian tubes. If you remember that anatomic picture I showed you earlier, that will give you better understanding. So you get a flow back into the fallopian tubes, to the pelvic cavity, and at that time the blood is flowing out through the body, through the cervix, and at the same time, you get part of it also flowing through the normal way. But in some cases, with this grade, at this grade, you get a backflow into the fallopian tubes. So another thing, when we're talking what can cause it, according to research, they reckon that it could also be linked to genetic factor. So if it's in a family, maybe if the mother has been diagnosed with endometriosis, or the sister or the daughter, so it does, you get 15% genetic association. And so according to research, so there's a genetic factor associated with endometriosis. And displacement of endometriosis. Oh, that's another thing. This is another theory that came up as well. What could be the probable cause of endometriosis? They reckon that when a baby is being conceived, during that development, they found that you get displacement of these endometrial cells can happen and begin to grow. So it's only now, it's only now when that child reaches puberty due to influence of hormonal influence during puberty. Now, this is when it can manifest itself in the real sense, showing all the symptoms of endometriosis. So they reckon that something may have possibly gone wrong during that development of a baby. So that's another research. And again, another one I found is due to hormonal imbalances. So especially with Jambi, as I said, she started her period at a very early age. And even the grandmother could not believe it when she told her. So as you can see, they are starting the period at early age before the 11 years, which is happening more and more like nowadays because of food that children are exposed to nowadays contain a lot of estrogen. We call it, as I said, we call it estrogen dominance, because they're exposed to all this type of food, all the environmental factors which I'll be talking about later. They're exposed to what you call xenoestrogen through pesticide, herbicide, or in addition to all this fast food. So you find that the children consume, even the milk, because cows are now, they are being fed with growth hormones so that they can produce extra milk, which is very sad. This is a milk which is not organic. So you find that there's influence or increase in the hormone called estrogen, as I said, estrogen dominance. And one research was done some years ago in Argentina. You find that the children, they were being fed on beef, and they were the same beef, they were at the same time, they were giving them milk. And you find this because of influence or increase in the estrogen by the age of 80, and by the age of 8 years of age, these children, they were looking like fully fledged women. We call it precocious growth because of too much estrogen in the system. So that could also could be part of the factors leading to endometriosis, causing imbalance in the hormones. So you get that, you find that the estrogen is higher than the progesterone. So like now, in most cases, you find that those people who are exposed to those type of hormones or having imbalance in the hormones, they have a short monthly period. Maybe like they find that their cycle is less than 27 days. So another probable cause of endometriosis could be dysfunctional immune system. The immune system is very, very important. So when the immune system is not working properly, so many reasons which I will not talk about today, it's also been responsible for endometriosis. And environmental factors. Nowadays, we're exposed to so many. We are exposed to a lot of toxins. Like we can see there, one of the environmental factors could be due to insecticide, all those in the spray on the land. Dioxin, which is another toxin. We refer to it as xenoestrogen from pesticide. Xenoestrogen is a man-made estrogen, not the normal one. Man-made. Due to exposure to the polluted environment, which is happening more and more nowadays. And here, another theory which could be a probable cause of endometriosis is what you call metaplasia theory. I understand this very well in pathology. You find that when we talk about metaplasia, it's when the cell in the body change to endometrial cells when it's exposed to hormones, like too much estrogen. You find that type of cell, which is not supposed to be in its original formation, because of being exposed to the hormones, it changes from one type of particular cell to endometrial cells. And it could be also due to exposure to chemicals or infection. So this is a very serious one. This is why I quoted this evidence here. You find that some of the men, when they are being treated for prostate cancer, and one of the conventional treatment for prostate cancer for men, they give them endometrial patches. One of the conventional treatment for prostate cancer for men is giving them an estrogen-derived drugs containing estrogen. And according to evidence or research, when they were doing an investigation, they found that these men, because of exposure to estrogen, at the end of the day, they end up having what you call endometrial patches in the bladder. Can you imagine that? Endometrial patches in the bladder because of being exposed to the drugs were used in the treatment of prostate cancer. So also, according to research, it can be due to nutrition deficiency, which is also what we're going to be talking about next week. When the hormone imbalance can be due to nutrition deficiency. And again, according to research, development of endometriosis can also be triggered by stress. which is on the increase nowadays, stress. And when your body says is being exposed to stress, you have a lot of these hormones being produced, cortisol. And the cortisol now, what does it do? The body is so complicated. It's so especially women's bodies, okay? You find that it's so intricate, so delicate. So any slight changes, you get a lot of problems like development of endometriosis. And when we talk about stress exhibits a lot of negative effect on the body. So now this, according to research, endometriosis can also be triggered by stress, which is very sad. And many people are going through a lot of stress nowadays due to economic situation in the world. Now, incidence and its association with infertility. When we talk about infertility, which was also mentioned in that introduction video, you find endometriosis is very common in childless women, especially when they're over the age of 30. You get more cycle. Why? Because every month there's no break. They're always having period. So this is influenced by estrogen. And this, as you can see, there's too much estrogen in the system. So this can also be associated with infertility in women who have been diagnosed with endometriosis. It can cause as I said, it's been associated with scarring blocking the fallopian tubes. And again, when we talk about infertility, when you get the fallopian tubes, where the egg's supposed to pass through, when it's all scarred, you're going to get, it's going to be blocked, and it will be unable to pick up any eggs at ovulation, which is critical for fertility. I hope you're understanding me. And again, you can see the ovaries can become scarred, and ovulation may occur, but the egg won't be able to pass through the normal place to be embedded. So this is why you find women who have been diagnosed with endometriosis, they are unable to conceive. Imagine the eggs become entrapped in that type of scar tissue. I hope you're understanding. And how is it diagnosed? Initially, when we come up talking about diagnosis for endometriosis, which most of the time, many women have been misdiagnosed, especially in the case of Jambi. So they normally ask a lot of questions. What are the symptoms? Any risk factors associated with this condition? Are they having any challenges with conceiving? Maybe some of them they've been trying to conceive, they cannot. So those are the things they ask people. Well, they also ask about the period. How long does it take? Is it very painful? Do they experience a pelvic pain or chronic during menstruation? Those are so many questions they keep on asking. Now, in view of all those questions, they can proceed to physical examination, like examine the pelvic area, check any form of tenderness or any pain, or if there's any palpable lump near the ovaries. And again, after that, they can proceed to surgical procedure where they can use what a system they call for examination in terms of diagnosis called laparoscopy. So this is where they have a small light now where they insert. So through that, they can make a small incision in the abdomen to view the area if there's any endometrial patches. And also another method of diagnosis can be like image testing, like they can use transvaginal ultrasound or MRI to identify any endometrial implant, maybe in the bowel. This is maybe in the bowel or in the bladder or any other surrounding tissues. So these are part of the investigation for endometriosis. Then they can also go through the colon. Okay, they put a light through the colon, and to find out so they don't miss anything, to make sure that there's no endometrial patches developing within the bowel. Very, very important. Those are the basic diagnostic system. And as you can see, there are different stages. That's stage 1, where you get an attachment. I won't go dwell too long on that. Stage 2, stage 3, stage 4. Hers with the Jambi was stage 4, with the implant extended to the lungs, thoracic 1. So that's what happens. Let me explain to you again, so you have better understanding of this condition we're talking about. Like this, you can see this is a normal reproductive system. This is the womb, all right, with the fallopian tube coming from each side. So if this is a normal area, you see, This is the womb. This is the muscular area I was talking about earlier. So we're talking about adenomyosis. So this is the muscle, okay, outside the womb. That's the neck of the womb. That's the vagina down there. Then compare with this opposite side, where also in the condition which Njambi was also diagnosed with, where you find endometrial cells. Now they or endometrial patches, they be extended to this muscular area. Compare this with this one. That's the condition, adenomyosis. Meiosis means muscle. So now you get infiltration of endometrial cells in the muscular area of the reproductive system. You can see all the growing there, extending from the myometrium. Let's move on. So, what are the, now let's talk more about treatment. So this is, as I said, initially they give them pain relief medication to relieve the pain. Or some women, they give them a combined contraceptive pills. You can't be on them for too long, but they are known to have a lot of side effects. And this apart from physical examination or therapy. And here, they can give them this one. They say GnRH antagonist. It's a long name, antagonist. And I know this one usually is given to some women who are bleeding through, bleeding a lot. So this is to reduce any pain or any pain, which is the effect of this, it actually helps to limit ovarian hormones, the effect of the hormones from producing estrogen, so that the less estrogen, the better that person will feel. Remember, we said it's an estrogen dominant condition. So, and without this treatment, you find that you get recurrence, which is not good. So then they can now another one here before actually leading to surgery. They can also, they give them the vaginal rings. It's like a ring they put inside the vagina, and it's embedded with a lot of progesterone. And again, this is all in order to reduce the effect of estrogen within the system, to reduce any symptoms of endometriosis. But this type of vaginal rings, they found it's got many side effects. Like it makes them feel, imagine a young girl now having hot flashes, going through as if she's already gone into menopause. Then they get vaginal dryness, reduce libido, then mood swing. Those are the side effects of that this treatment, to reduce the amount of levels of estrogen in the system. So another one, which is, look at this, it's the weak male hormones, which this is an attempt to make sure that estrogen levels are reduced. So they can give them this one in terms of reducing the symptoms, and look at the side effects. Again, mood swing, dizziness, they start having headaches, acne, weight gain, because this is the weak male hormones. So they can start to grow hair, you can see, and now exhibit male pattern type of effect. Deepening of the voice, and increase libido, sex drive. That's another one. That's the side effects of this. When I'm talking about conventional drugs, they have a catalog of side effects. So another one here, aromatase inhibitors. I know they use this for women who have been diagnosed with breast cancer, in order to reduce the amount, especially those estrogen positive type of cancer. They use aromatase inhibitors. And they also, because the attempt is to reduce the level of estrogen in terms of for treating endometriosis. So one of the side effects here is they start having issues with their bones. They start having what you call osteoporosis. The calcium the bones becomes very weak, and any slight fall, it can get fractured. And also another problem is heart problems. Imagine that those are the side effects. Now, if they decide to proceed to surgery, again, the surgical procedure, which Jambi went through, there are different stages again. Some women, they can now say the only way to stop these symptoms or this condition, endometriosis, to go through to have a total hysterectomy. And when you're talking about total hysterectomy, that means the removal of the ovaries and the womb. That's a total. And when this happens, obviously after this, a woman cannot conceive anymore. And they go, because they're still very young, what they do, they go into spontaneous menopause. Very sad. And you find with the hysterectomy, total hysterectomy, it helps to reduce, according to research, it helps to reduce pain in about 80 to 90% of women. And sometimes another thing for treatment, also they can use IUCD, intrauterine device, which they soak it with anti-estrogen hormones, and which is also known to have a lot of side effects. I hope you are following quickly. Now, as I'm not going to keep you too long today, you can see now everything is, remember, I said this is to do with a lot of estrogen in the system. First of all, when we're talking about estrogen in the system, we are talking about, this is where diet is very, very important. I believe you are what you eat, what you consume, digest, and absorb. And your health is your greatest wealth. Feed your body with the right nutrients, and the condition of endometriosis will be a thing of the past. This is very, very critical. We're now living in an age where we want everything quick. In many households, you don't find the cooking pot. The youngsters, they go to the shop, they buy all this food which are already ready-made, and just pop into that idiot component in the machine called a microwave, because they don't have time, or they just, no, it's a fast life. Okay, so we call them all those, and we call empty calories, nutrient deficient type of food. Or it's okay occasionally as a treat, but when you're making a habit of daily consumption of this is really detrimental to for general wellness. And especially when all these things are full of hormones, they are full of cancer-causing agents, because they contain a lot of they contain, as I said, a lot of cancer-causing agents. You can see the picture shows it all. All those things that you see on the high street in the evening, of sausages, all those different drinks. These are detrimental detrimental to general wellness, especially talking about endometriosis. They are laden with a lot of fat, trans fat, a lot of sugar, a lot of all those increasing the amount or the levels of estrogen in the system. So your diet should focus on, any good diet should focus on food that we get rid of excess estrogen. We are talking about this now. We cross over to this side. This is what we are recommending, because all these are known, especially we are recommending organically grown food, vegetables, fruits. This is what we are now recommending. But when they are, nowadays, we are consuming a lot of food which have been exposed to a lot of xenoestrogen, that's artificial estrogen, all those pesticide, herbicide, glyphosate. These are known, they've been associated with development of endometriosis. They are not organically produced like with the type of food that our great-great-grandparents used to consume in those days. We are consuming a lot of toxins, a lot of chemicals, a lot of dioxin, which is very, very sad. What is the way forward? I don't know anymore, especially with the current situation in Kenya. I don't want to go into the political side, but I'm sure many of you are well informed about what is going on with the food we consume nowadays. But this is why they're saying, according to research, they say children of nowadays, they will not live as long as their parents because of all these rubbish things we are now exposed to, consumption. And we are expecting optimal wellness. No way, we cannot, because all the food we are consuming, they are artificial, they are genetically modified, they are being sprayed with a lot of environmental toxins, as already mentioned. We're in trouble. So you're going to see, unfortunately, we're going to see increase in the incidence of endometriosis because of all these things we are consuming here. This is what we should be consuming. organically grown. Even we're talking about dairy products, we have to make sure that it's not easy to get nowadays. You don't know where the milk where the milk comes from. The cows, they are now the cows that, as I said before, they are now they're giving growth hormones so that they can grow quickly. Even the chicken, within 3 months, you see a huge chicken on the table. Why? It's not like the Kenyaji one, because it's now under the influence of hormones called estrogen. Imagine consuming of that, the resulting effect is the development of endometriosis. And even the meat we consume, and the meat, the milk, everything. So let me move on. I know you have a full understanding of what the situation we are facing in this nation. So this is why we're talking about organically grown Brussels sprout, broccoli. According to research, they found that sprout, cabbage, cauliflower, they contain a lot of what we call anti-estrogen. This is what we should be consuming. Look at the food I'm talking about. Empty calories. These are the things. We should be full of estrogen. And here, look at that meat, minced meat. And this minced meat, God knows, is full of fat. And that fat may be, high percentage may be estrogen. So imagine consuming all this. All this is full of trans fat. This now can, all this daily consumption of, regular consumption of this type of food can lead to the development of endometriosis, trans fat. And don't forget, this also eventually leads to obesity. And according to research, they said Kenya is the 9th in terms of endometriosis, in terms of obesity. Kenya is the 9th when we talk in the world in terms of obesity. So we're in trouble because of all this, especially we are consuming more of this, all the youngsters containing trans fat. And when we're talking about obesity, you find that the fat cells, they trap a lot of hormones, they trap a lot of estrogen. Estrogen has spewed out because of too much fat in the system. That's the fat cells contain a lot of estrogen. Leading to what you call a condition, situation called estrogen dominance. So according to the British, according to a study published in the British Medical Journal, which revealed the excessive consumption of all these, these are all classified as ultra-processed foods, which are known, according to that research by written or study in the British Medical Journal, they found that many people are now consuming all these ultra-processed foods nowadays. There's a likelihood of them having issues with hormone imbalances, leading to endometriosis. So you find a total, in that research, you find that a total of 105,000 adults, they took part in that research, consuming those ultra-processed foods containing high levels of sugar, salt, saturated fat, and trans fat, resulting in obesity and associated with high levels of estrogen. Look at this. Consumption of wheat, or how would that quality gain? Wheat also, this bread, is been associated with too much of this wheat has been associated with increase in incidence of endometriosis. All these things, these are what people are now consuming nowadays. Too much sugar, too much wheat in the system, okay? And again, you can see all this, even all these things. Some chocolates are also considered to be being classified as ultra-processed foods. All this concern of all these fizzy drinks full of sugar, apart from artificial colorings, they have been associated with endometriosis. Don't forget, all these are, we call it empty calories, anti-nutrients. Alcohol consumption is also an oxidant when they cause a nutritional deficiency leading to endometriosis. If you remember that slide, when I was talking about nutritional deficiency, it's association with endometriosis. All this fast food, all these things that people, they can't wait to make proper sauce anymore. They are not buying sauces, all these things, all this prepared, ready, quick. These are all rubbish. Does not contribute any nutritional wellness at all, leading to endometriosis. They call this is a fake extra virgin. It's in the transparent plastic container, and it's not a true, when talking about extra virgin olive oil, which is known to be anti-inflammatory, containing flavonoids, which are known to help in terms of inflammation, to control inflammation. It's in a wrong bottle. It should be in a dark bottle, not like this. So to me, this is fake extra virgin because there's money now about extra virgin olive oil. So they're getting all these rubbish stones coming out. So these are all these things in conclusion we should try to avoid, not recommended at all. Now, the meat we consume, we're talking about meat here. Don't forget, as I mentioned before, that research which was done in Argentina, where the cows now, as I told, let me go back. Cows nowadays, they are not like those cows in the olden days. Cows, they are no longer grass-fed, they are grain-fed, which is against nature. In addition to that, when the cow is grain-fed, it's not able to, it's not normal anymore because the cow has got 3 digestive systems or 3 stomach. And now you find that as a result of being fed with grain instead of grass, they now develop what we call inflammatory reaction. They experience pain, inflammation because it's not normal. And in order to counteract the effect of that pain being experienced by cows before they get to the slaughterhouse, what do? They now give them antibiotics. And when you're giving antibiotics, who's the end consumer? Is it not us human beings? And this, apart from that, the cows, they are being fed, as I said, I keep on emphasizing, so they can grow big and start producing a dairy milk cow, a dairy cow. They give, even pregnant ones, they give them a lot of hormones so they cannot produce extra milk. And that hormone, growth hormones, is known to have increase in the levels of estrogen. That's a growth factor, leading to endometriosis. I hope you are now understanding me properly. The causes of endometriosis. In the food we consume nowadays, we are eating rubbish. Basically, we are now eating, it's not food we're eating anymore. This is why people are getting sick and sick and sick. The milk is packed with chemicals, additives, preservatives, in order to make them stay longer. There was a research which was done in Kenya some years ago, I'm sure some of you remember, where they were using all those different things, potassium metabisulfate, they mixed it with water, and they pour it on the meat as well to make it look fresh, apart from the meat which is already killed with a lot of hormones. So now this is what we're talking about. In order to reduce in order for to become a victim of endometriosis or to reduce the incidence of endometriosis, we are now saying that it's better to be eating more of vegetables than this type of meat we are consuming nowadays. You know why? Because red meat contains what you call arachidonic acid, which encourages production of prostaglandin. Sorry to you should avoid and also try to avoid consumption of dairy milk, also anything with the cows nowadays, unless it's truly organic. Reduce consumption of that because of the influence of estrogen. So those are the things we said we should be consuming. All those natural, like these chickpeas here, which are known to contain what you call natural vital estrogen. Is different from the estrogen we've been talking about. This is a plant-based estrogen. This is a vegetarian type of food. You can see tofu is instead of meat all the time. Tofu, I like tofu. It's like instead of meat, tofu is fermented. It's very good for the digestive system, and it's not influenced by the type of estrogen we've been talking about, leading to endometriosis. Tempeh is another one. These are all fermented food, which is very important for the digestive system. We're talking about omega-3. We're talking about wild yam because this is anti-estrogen. The cream is also very important. And again, we're talking about probiotic and prebiotic, which we'll be talking about more next week. These are just natural way of in terms of treating this condition called endometriosis. Now, this is another method here, acupuncture, consumption of resveratrol, which is full of a lot of nutrients, anti-estrogen, and you can see all this colorful fruit contain a lot of vitamins, a lot of minerals. These are what we recommended to reduce the incidence of endometriosis. Green tea is also contain a lot of reducing the incidence of reducing the level of estrogen in the system. Now, these are all these light exercise, because when you exercise, it helps a lot to reduce pain. This is another one, osteopathic therapy. These are all just different ways of minimizing the incidence of endometriosis in terms of natural treatment. Now, this is CBD oil. Also, this is very popular nowadays. Turmeric contains a lot of antioxidant, and it's highly recommended. We'll be talking more about this next week. Let me move on. And also, these are all the food we are recommending. So I'm finishing here. This is a lot of vegetables I already mentioned, and grains. A lot of, it's better to be consuming a lot of vegetarian food instead of all this meat all the time. And you can see their natural good fat from avocado, which is we are now recommending nowadays. These are other herbs. You can see a bit there like what we have in our products. I'll be talking more next week. Ginkgo, that's a leaf, that's ginkgo leaf there. And a lot of what you call phytoestrogen supplements, natural estrogen, very, very important. Hormone regulated supplements is highly recommended. According to research, they found that the type of fat included in diet makes a big difference in your, when you talk about endometriosis. This is why I would say try to avoid consumption of those wrong fat, trans fat. And another study showed that the people whose diet were heavily laden with trans fat, and this is another research here, they were exposed, they were 48%, can you imagine? 48% increase in incidence of endometriosis in comparison with those who were not exposed to trans fat. So omega-3, another one we'll be talking about it next week. Now, women whose diet were rich in omega-3 oil, they had the lower risk of endometriosis by 22% in comparison with those who were not consuming enough omega-3 fish oil. We'll be talking more about that more next week. Eating food high in omega-3 fatty acid, like all these things we'll be talking about next week, is known to be helpful in the management of endometriosis. I'm about to finish. So high intake of fresh fruit, highly also, those are the things, according to research, they are known to increase, to actually reduce the incidence of endometriosis by 80 to 100%. Very, very important when talking about, to reduce consumption of red meat. Those are the ones I was talking about earlier on. When you reduce consumption of all this, you find that also going to reduce your risk of becoming a victim of endometriosis. So I'm going quickly now as I'm finishing. Vitamins and supplements, according to research, they found the deficiency of all this vitamin D, which is very, very important, especially vitamin D3, helps to, when we talk about reduction of endometriosis. And other antioxidants like all this A, C, and E, very important, we'll be talking about next week. And again, I mentioned about stress. Stress can trigger endometriosis. You find that it's very, very important to know how to manage stress. Little stress is important, but not chronic stress. Not, that's what we're talking about. Exercise, I've already mentioned about exercise, very, very important in management of endometriosis, because why? It encourages the circulation of blood to all the organs, maintaining nutrient and oxygen flow to the body to decrease the amount of estrogen in the system, and in the same time reducing stress, because what happens, it helps to release endorphins, which is what we call the feel good factors, the hormones like dopamine, serotonin to the brain, which are prevailing to, these are, as I said, feel good chemicals. So in women who, according to research, women who regularly exercise are less likely to develop endometriosis. This just basically showing the importance of exercise. not too much strenuous. So this is all about essential consuming all this natural food here. Contain a lot of fiber, because again, when your food contains a lot of fiber, it helps to reduce the levels of estrogen in the system, according to research, and also help to boost the immune system, which is very, very important. To have a strong immune system, we give you resistance in the development of endometriosis. Like all these vitamins we'll be talking about more next week, all the B vitamins are very, very important, especially when we talk about the liver. Liver is the organ of detoxification. So it helps to reduce involving, it helps, in the liver, part of the work of the liver is to convert excess estrogen into weak ones. So that's why it's important to consuming food contain a lot of the B vitamins, like the B vitamin 6, vitamin B6 helps to reduce period pain, and another antioxidant, vitamin E, which helps to reduce menstrual cramps, according to research, in 70% of women with endometriosis. Now, when we talk about magnesium, which we also get from vegetables, we said magnesium itself is a muscle relaxer, including the types of with the back pain being experienced in patients with endometriosis. We've already spoken about essential fatty acid because it helps to reduce inflammation in combination with zinc and vitamin B6. So we'll be talking more and more about this next week. I hope you'll be able to attend. I've already mentioned about the importance of fiber in the diet, because according to research, it's been known that people who are consuming a lot of fiber in their diet, it helps to reduce excess estrogen in the system, because if there's any excess, it's reabsorbed and recirculate back into where it should exit. Oh, so these are the time when talking about fiber. This all the food example, chickpeas, name it, grains contain a lot of fiber. Very important. You can see all what we have. We are so blessed in this nation. You can see sweet potatoes there, fruits there, all different types of beans, and all these colorful fruits contain a lot of antioxidants. Very, very important as part of the fiber for your diet to help to reduce any pain during when it comes to passing, to make everything easy, reduce pain during bowel movement. Very, very important. So, and again, balance, it is important when talking about balancing the digestive system, because according to research, they said that a high percentage of women with, this is now the relationship between endometriosis and women who have been diagnosed with irritable bowel syndrome. Okay, it's an autoimmune disease. A disease, when I say autoimmune disease, is where the body is seeing itself as its own enemy. We call it's one of the problems within the digestive system. We call it irritable bowel syndrome. So it's been associated with endometriosis, according to research. And another research in Australia in 2009, and it concluded that there's a relationship between the digestive system and gynecological symptoms in women with endometriosis. So there's a link between the stomach, the digestive system, and the reproductive organ when we're talking about endometriosis. Very, very important. And it is important to balance also, there's a relationship also in terms of nutrition, to balance your digestive system, which we'll be talking more when we're talking about the products to manage natural, scientifically researched organic products. We're talking about it next week in the management of endometriosis. So then I'll be able to talk more about the importance of balancing the microbiome, which is a population or collection of bacteria, virus, and yeast. So those are very, very important to keep a balance, because in your digestive system, especially in the colon, the big intestine, you find your population of bacteria, the good ones and the bad ones, they all live happily together until we start taking antibiotics. So it's very, very important to maintain that balance, that equilibrium. Very, very important in terms of maintaining homeostasis and making sure that we don't become a victim of endometriosis. So this is where, because these bacteria we're talking about, they work together by producing what you call probiotic. okay, with butyrates. I don't want to be too complicated here. So we want to make it simple. They produce vitamin K, they produce a bacteria, they produce a lot of beneficial things. They produce also something to manage, to balance the immune system. Because when you've been diagnosed with endometriosis, remember I mentioned about immune dysfunction, the immune system not working optimally. So these bacteria help in order to make sure the immune system is balanced. This is why we now need prebiotic, which you get in aloe vera and in garlic, in onions, which I'll be talking about next week, together with probiotic, which we also have in the products I'll be talking about next week. So when your microbiome is balanced, you find that there's a good balance of estrogen, which is maintained. However, if those bacteria, the microbiota or microbiome diversity, those bacteria, if they are not balanced and there's abundance, too much of the bad ones, like we call it pathogenic bacteria, this can drive the production of estrogen in either direction. Hence, endometriosis there's increase in incidence of endometriosis. So thank you very much. I finish here. Thank you for your for being a good audience, and I love you dearly. So next week, part 2, I look forward to see as many of you as today. So that we'll be talking about the solution when in terms of the management of endometriosis, in terms of prevention and management of this insidious disease called endometriosis, which is on the increase nowadays. So thank you very much once again. I love you all. And again, if there's anybody question as we're finishing, please, you are welcome to ask as many questions as possible for those who are still on the platform. Emmanuel?
There are 2 questions on the platform. I think they're related. Okay, comments are moving faster. Let me scroll up. Is it? Yes, can someone with endometriosis still be able to conceive?
Oh, that person was not listening properly. Okay. It depends on the stage. Remember, I said there are 4 stages of endometriosis. The early stage, if they're able now, they can cauterize. Now they can use heat. They said diathermy in pathology or in the surgery. Okay, they can use that one to burn the patches of endometrial cells. And they always tell the women, just like fibroids, similar. So they just tell that woman this is where nutrition is very important, to make sure they're not exposed to excess estrogen. Remember, I said endometriosis is estrogen dominance, estrogen driven. So the food they consume must be 0 estrogen, and they always tell them to hurry up to consume within 6 months after that operation. After that, once they do that small operation, which is a diathermy, all right? So they can, at the early stage, yes, they can conceive. But again, if the problem, the issue, as I said before, especially in Kenya, is misdiagnosis. So it takes long. By the time a woman is being diagnosed, and they find that the situation like what happened to the lady who passed away is too late. It's advanced. So I hope that answered that person's question.
Okay. I think there's no other question rather than compliments for the training. Thank you so much, leader. That was very, very impactful. And we're all waiting for part 2 next week.
Okay. I look forward to that. That's where we're going to have the solution. Okay. We have amazing products to help people. And somebody is asking a question. All right. Somebody I think that one. Okay, it is okay. Okay. All right. There was another one, but it's no longer, I can't see anymore. So that person has moved on. So I assume that we can now close the session. Is that okay?
I think the question, Vitalis, do we dash, or is there a relationship between genetics and endometriosis? I think that's the question.
Oh, that person missed it. It was on the slide. I was saying that 15% of women, there's a 15% association with the genetic factor. 50%. Of 50% of endometriosis is linked with genetic. There's a genetic factor. On that slide, I said, if your mother has been diagnosed with endometriosis, your sister or any close relatives, okay, that's a genetic factor. And this is also where I mentioned that apart from that, this is what I also mentioned that when the woman is pregnant, during that period, there's something could go wrong. Again, we're talking about nutrition here. Nutrition and conception. Something can go wrong where the lining of the endometrial cells can now transfer to the fetus, to the baby. So that baby, when it grows up to puberty, it can also lead to development of endometriosis. So going back to the question of that person, yes, there's a genetic link with endometriosis, 15%. I hope that person is happy. But for me, as a clinical nutritionist, you can actually delete that genetic factor depending on on what you eat and what you don't eat. So, and exercise, we call it lifestyle. So you can delete that genetic factor, can be deleted depending on your lifestyle. That's my belief. And when we talk about lifestyle, it involves a lot of discipline. Not eating those rubbish. All right? I call it garbage, which many people are consuming nowadays. All right? And making sure you eat a lot of nutrient-dense food. You know, when you eat beans, the beans can fill you up quickly because it's full of fiber. It's full of all those natural nutrients. And you put pili or different ones. You put garlic, put ginger. You make that food looking rainbow color. When you see, before you even eat it, looks inviting. Not eating as if there's no tomorrow. Otherwise, you become obese. You know, obesity and endometriosis is also linked because of those fat cells carry a lot of estrogen. I hope that's enough. Hello. Hello, I can go on and on. I'm very excited. Not that I'm not excited about the person who passed on. Okay, I really admire her. And this is why we are trying to rescue many women from becoming a victim of endometriosis. But I have seen a lot in pathology. It's very interesting. Wow. Yes. So any more questions? Yeah?
There's no more questions. I think you can stop there for today. That was very interesting. Thank you so much, everyone, for participating. You can shoot the questions before the training, and then, of course, we can wrap it up. So, but for today, we appreciate your time. Thank you, Josephine.
Okay, thank you all the same.
All right. Bye-bye.
Good night. Good night to you all. Good night. Look forward to next week.